Dear everyone, welcome back. I hope that you had a chance to get a quick cup of coffee or to make a few stretches and are fully energized for the remainder of the forum. I'm very happy to introduce our keynote speaker of Team 4 on the role of technology and knowledge management, Dr. Mona Saraiya, medical officer and team leader of the Division of Cancer Prevention and Control at the CDC in the USA. As it's late at this, or very early actually in the USA at this moment, we will be watching at a video of her.
Greetings, virtually from Atlanta. I am Mona Saraiya. I'm a physician and epidemiologist working at the CDC, and for the last 2 years, I've also been working part-time at the National Cancer Institute for the Cervical Cancer Moonshot. I'm honored to be invited and speaking to such an esteemed audience about technology, innovation, and knowledge management. I have no conflicts of interest to disclose. And I'm delighted for Cervical Cancer Month in January. Wanted to acknowledge that we are on the heels of a monumental initiative that started in 2018 and now has been launched in November of last year, just in time for a new era. As a reminder, the goals for member nations for 2030 by the World Health Organization are to ensure vaccination, screening with a high-quality test, and appropriate follow-up and treatment of both precancer and invasive cancer. So ultimately, we will have less mortality from cervical cancer. Technologies and innovation and knowledge management can occur across all levels of cervical cancer: vaccination, screening, treatment. And innovation includes innovations in partnerships and communications, increasing access to services, new methods to screen and treat, clinical decision support. And I just wanted to say, even though we are in an era of the COVID pandemic, many of these interventions that I'm talking about are actually more meaningful during the pandemic, innovations including telemedicine. So starting off with HPV vaccination, in the United States, HPV vaccination is recommended at age 11 or 12 years in the United States. It can start as early as age 9 or 10. And ideally, preteens should finish their series by their 13th birthday. Everyone ages 13 to 26 who haven't started or finished the vaccine should also be vaccinated. Some adults, 27 through 45, can also get the vaccine based on a discussion with their clinician. However, in the US, coverage of vaccination since it was approved in 2016 has been slow and steady. Most recently, only 54% of adolescents had finished their series in 2018. CDC has launched a number of activities to improve HPV vaccination, and I'm just going to highlight partnership activities here, but I just wanted you here to see all the different activities that we have launched. One activity related to partnership is the National HPV Vaccination Roundtable. It's funded by the CDC, but it's managed by the American Cancer Society. And its mission is to raise HPV vaccination rates and prevent HPV cancers, not just cervical cancer, in the United States. The vision is that we see an immunization rate of 80%, and we want to, of course, support the WHO initiative. The National HPV Roundtable has 70 members, including partners from immunization and cancer prevention, survivors, organizations, professional provider organizations, health plan, etc. The organizations were strategically identified to represent key constituencies that impact delivery of HPV vaccination. And as a result of this consortium, we have developed a number of resources. And here I just wanted to give you an example of some of the resources that are available. And at your leisure, please take a look. We in the United States also have comprehensive cancer control plans for each state. And as a result of the partnership with comprehensive cancer control plans, we have increased HPV vaccination uptake. That includes really in-depth teams to provide technical assistance to increase HPV vaccination coverage. There's also a lot of innovation occurring across communication activities to support HPV vaccination. For example, we have materials for clinicians, for parents, for partners and programs, and I urge you when you get a chance to look at these materials. But these materials have been developed with new research that show that that have allowed us to revamp our messages. For example, patients want to hear about HPV vaccine in the context of cancer prevention, not sexuality, something that we heard throughout our focus group findings. So therefore, the new message has been that HPV vaccine is cancer prevention, and there's been a whole campaign that's been created around that. These are just examples of how some of our messages have been refreshed, and I'm not going to go into more detail, but if you get a chance, you can see how innovation has resulted in improving and prioritizing HPV vaccination and showing that it's not just for high-risk persons, but it's for everyone. And these are just some other examples. One example I particularly like is the one in the lower left-hand corner that talks about how HPV vaccination can protect cancers, but we often don't think about the pre-cancers that they're preventing, and we often don't mention that screening is definitely not available for most of the other cancers besides cervical cancer. So highlighting the importance of what HPV vaccination can do. One of the exciting things that has been occurring at CDC has been using data to monitor the impact of HPV vaccination. For example, we know in the United States and globally that even with our low coverage rates, or what one might think might be low coverage rates, HPV infection has gone down dramatically in the United States. So has genital warts. We've also seen an impact on cervical cancer, cervical precancers. But what about invasive cervical cancer? I know many of us want to know, when are we going to see that? Well, I believe we have already seen that now. A Swedish study published in the New England Journal of Medicine showed an association between the receipt of the quadrivalent vaccine and the incidence of invasive cervical cancer among nearly 2 million women aged 10 to 30. They found a 63% reduced risk of cervical cancer, and the decreases were greater among those that were vaccinated earlier. 88% reduced risk among those that were vaccinated under 17, and 53% reduced risk among those that were vaccinated between 17 to 30. Here in the United States, I was part of a team that published an article using cancer registries to look at trends and incidence rates among invasive cervical cancer. And we limited this analysis to women under 30. And it was innovative because we're able to use registry data that covers the entire US population. And we found that rates of squamous cell carcinoma and adenocarcinoma decreased. And the decreases were the greatest among those 15 to 20 years, pointing to a vaccine impact. The largest decrease occurred among women ages 15 to 20 years, and with squamous cell decreasing almost 22% per year after the vaccine was introduced, and adenocarcinoma also decreasing 9.4% per year after the vaccine was introduced. So both of these studies reinforce the benefits of vaccination for the prevention of invasive cervical cancer and support the modeling study that was published recently that's showing that widespread coverage of both vaccination and screening could prevent almost 13 million cases of cervical cancer worldwide. So we need to be able to monitor these trends and make sure that our information systems, such as cancer registries, are used effectively. Globally, we know that HPV vaccination has been introduced for girls into national immunization programs. The vaccination for boys, of course, is based on cost and vaccine availability. And so considering one dose for girls, if there's limited availability, is really important. And luckily, even though we're expecting a shortage until 2025, we do think that this study supported by the NCI and the 1 versus the 2 dose trial of Gardasil and Cervarix will be very important as accrual has almost completed, and we expect results to be available by 2024 and 2025. Now switching to screening. In the United States, almost half of the incident cervical cancers in the US are among women who have never or rarely been screened. Our current U.S. guidelines for screening include screening women ages 21 to 29 every 3 years with PAP-based screening, and 30 to 65 every 5 years with HPV testing alone, or you have a choice of every 3 years with PAP testing or every 5 years with co-testing, which is HPV and PAP combined. Even with all these guidelines and recommendations in the United States, 8 million women were not screened in the last 5 years. 7 out of 10 of these women who were not screened had a regular doctor and health insurance. We think the reason women are not being screened is because of the message about screening. It may not resonate with women that are low SES, lower educational attainment. Also notice lower screening rates among racial ethnic minorities and those that were foreign born, and those that reside in rural areas or areas where screening isn't adequately placed, such as in the Appalachia, the US-Mexico border region, the Pacific, which is also part of the United States. So self-sampling for HPV testing really offers really good solution. It's easy to collect. It's a vaginal sample. Women can choose the time and place that they want to be screened. They can do it themselves in privacy. And I think that's really important in Muslim cultures or in regions where a male provider may not be around. So, because there's no need for an appointment or speculum examination. And the kits can be mailed back and forth or could be brought back during other clinical visits. Self-sampling is really not a new concept. It's already been offered to those in organized screening programs in Europe, those that don't attend screening. Studies have shown high patient acceptability for self-sampling based on screening, and other advantages are listed here on this slide. There's been meta-analyses of several studies showing self-sampling is based on HPV testing has higher sensitivity compared to cytology, and it's comparable to physician-collected or clinician-collected HPV-based screening. However, in the US, it's not being used as a strategy because there's no FDA approval for self-sampling. So the Last Mile initiative basically is trying to get the information necessary for an FDA approval for all currently approved HPV assays in the United States. And so this offers a lot of promise. In addition to self-collection, there's development of several screening and triage technologies by the National Cancer Institute that's working on these as part of the Moonshot. These include automated cytology, dual stain automation, and these are really important for high and middle resource settings, and I have also provided some references. There's also HPV testing with extended genotyping, meaning that knowing not just whether it's HPV positive, but to know which specific type is important for screening, as well as a real promising innovation is automated visual evaluation, really promising in a low resource setting where visual inspection has been used with acetic acid, VIA, but we know that VIA is not as accurate as it could be. But with artificial intelligence, we're able to show that VIA and taking existing images of cervical images can improve VIA markedly. So look out for a lot of these and read some of the references if you get a chance. One of the other things that CDC has embarked on is to improve clinical decision support tools to make screening and follow-up easier for the clinicians. We no longer really use paper guidelines in the United States, and we have electronic health records, but how can we make these electronic health record systems more efficient? The ASCCP guidelines for managing abnormal results are quite complex, really hard for anybody to really follow unless they have a computer algorithm. They're based on risk, not just test results. They're not just based on your current results, but you need to know your past history. And although there's a mobile app available, it's not connected to electronic health records. So we here at CDC wanted to sort of come up with something to make computable guidelines work. So this is a slide basically showing how you can go from a paper guideline to executable clinical computable guidelines, taking advantage of existing data in electronic health records. This is a 4-year project that basically has just started, and we just did an environmental scan on this. And we're basically learning that the clinical decision tools can be used in many areas. They could be patient-facing, laboratory-facing, and clinician-facing to make it easier for adherence of both screening as well as management, and really for underserved populations where there may not be an OBGYN, but a primary care physician. And of course, going on to precancers, screening and treatment of precancers globally, there's a lot of innovation occurring. The WHO is working on pre-qualifying more HPV diagnostics, and the WHO has also approved thermocoagulation for treatment of precancer. And I can go on and on. There's innovation that's been done in cancer diagnosis as well as needs, gynecological surgery and symptoms, treatment of invasive cervical cancer to improve access to and quality of radiation therapy, quality of survivorship care, and palliative care. We also need to strengthen health data systems. I won't go into detail. And then there's an ongoing need for clinical research. You can see some of the awards that the NCI has given internationally for cervical cancer. And of course, we need to strengthen research through mentoring and national support and cohort research and clinical trials. So in summary, innovation can occur through all aspects of cervical cancer, from vaccination to screening to treatment. And it takes many forms, from communication and partnership all the way to new technologies. We have a cancer that's fully preventable. We can achieve the WHO goals, and it's a role model for other cancers. So let's do it. Thank you so much. And I want to thank my collaborators who lent me their information and slides. If you have any questions, please send me an email. Thank you.
Dr. Mona, thank you so much for sharing on the role of technology, innovation, and knowledge management in overcoming cervical cancer. We now will deep dive in this a little bit further with panel 3, that will look at the role of technology, innovation, and partnerships in achieving equitable access to cervical cancer services. This will happen under the leadership of Anja Nitzsche, Head of Resource Mobilization and Strategic Partnerships at the Program of Actions for Cervical Therapy of the IAEA in Austria. Anja, the floor is yours.
Thank you so much, Rode. I'm really pleased to be here today with you from Vienna, Austria, sending our regards at this exciting event. Also, thanks so much to our wonderful friends and colleagues from the Friends of Cancer Patients, as well as UNFPA, for inviting us and this interesting panel today. As Rode, you already said, so my name is Anja Nitzsche, and I'm the head of resource mobilization at the Program of Action for Cancer Therapy at the International Atomic Energy Agency, IAEA, in Vienna, Austria. And I'm joined today by a wonderful panel, two of outstanding professionals and colleagues. We have Dr. Hayat Sindi, who is the Chief Advisor to the President of the Islamic Development Bank, responsible for science, technology, and innovation, and for community outreach, as well as Dr. Abdullah Abdulrahman al-Sumait, the General Manager of the Direct Aid Society, a very well-known and highly accomplished voluntary non-governmental organization from Kuwait. As you know, the topic is now the role of technology, innovation, and partnerships in achieving equitable access to cervical cancer services. This is a very important aspect, because over the last 2 days, we have heard so much about varying aspects on policy issues, on new advances, on community involvement, etc., to really achieve progress on the elimination of cervical cancer. However, in order to really take it to the next step and also look for potential game changers and achieve the ambitious targets we have set, we really need innovation, and innovation in a broader sense. I think everyone knows that the current setup in that we are experiencing caused by the COVID-19 pandemic has shown us that innovation can move at at the neck-breaking speed. So we are seeing new treatments, vaccines developed very fast, new technologies coming up. And of course, that also brings promise for our work in other areas, including on cervical cancer. Here, I just wanted to say that oncology in particular has already benefited over the last decades from enormous progress on innovation, science and technology. And you already heard from our colleague Mona just now on what has happened in the US. But of course, also cancer patients across the world have benefited big time in terms of increased survival rates and also quality of life. However, progress has been uneven, and also access to innovation has been uneven, unfortunately, and we really have to think through how we bring more of those benefits to all of the women, all of the girls, and everyone who needs it if we really want to move towards the elimination of cervical cancer. And this is exactly what we would like to discuss with you today, thinking about innovation not just in terms of science and technology, but also in terms of being innovative on partnerships, being innovative on access to finances, being innovative in the way how we deliver services. And I'm really happy to have an outstanding panel here to discuss this today. So let me briefly introduce our first speaker, Dr. Hayat Sindi. As I already mentioned, Dr. Hayat Sindi is one of the most senior staff at the Islamic Development Bank and a trusted advisor to His Excellency, the President, Dr. Hajar Bandar. She was also the first woman from the Gulf to obtain a doctorate, a PhD in biotechnology from Cambridge. And she is an alumni also of Harvard and MIT. In 2018, she was voted one of the BBC's top 100 women, a list of inspiring and influential women from around the world. She is also UNESCO Goodwill Ambassador and one of the leading global experts serving on the Scientific Advisory Board to the United Nations and its Secretary General. In 2018, she launched the ISDB $500 million Transform Fund and Engage platform to support innovators find solutions to the development challenges via innovation, the first digital hub of its kind for the developing world. So Dr. Hayat, I'm pleased now to pass on the floor to you. And we would love to hear about the role of the Islamic Development Bank in driving international efforts for sustainable development and health for all, including to the benefit of women affected by cervical cancer. The floor is yours.
Thank you, Anja, for the great introduction. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good afternoon, everyone. It's my great honor and pleasure to be with you here today. I'm just going to switch off my camera a bit because I'm just over the internet, if you don't mind, and I'll come back again. Is that okay, Anja?
This is fine, Dr. Hayat.
Can you hear me?
Yes, Dr. Hayat, we can hear you. You can continue.
Okay. Do you have my presentation?
Yes, it's on the screen now. You can just tell me when you want to go to the next slide.
Okay, I cannot see the slide, but I'm just going to ask you to just move on to the when I finish to the next one. So sure. I just wanted to say thank you very much for inviting me to join you today as we're going to discuss this exciting new program with IAEA, Islamic Development Bank, which has partnered together for financing and access of cancer services in low and middle income countries. Next one, please. The sector is a priority area for ISDB, and we are very, very proud of our partnership with IAEA. Our program, as you can see, it's called Saving Women's Life from Cancer, and is designed to aid the development of national cervical and breast cancer programs within our member countries and also worldwide. And ISDB has been committed for a long time to the global fight against cancer. And now more than ever, you heard Dr. Mona, you heard Anja, with the background of COVID-19 pandemic, must not forget issues like women's cancer. And since 2013, ISDB has approved more than 364 million in grants and loans for cancer control programs in IAEA member states, including Senegal, Uzbekistan, Niger, Guinea, Vietnam, and Djibouti. But of course, there's more to be done. Next slide, please. According to the International Agency for Research on Cancer, worldwide, more than 8.6 million, you hear that from today and yesterday panelists, more than 8.6 million women suffer and may die from largely preventable and treatable cancers. And this situation is most pronounced and more advanced in the low and middle income countries. And this is, of course, not acceptable, unfair. We hear that, given especially the cost of treatment.
Hi, Dr. Anja. Seems like Dr. Hayat has lost the connection again. We are trying to reconnect her. Would you like to take the next panelist while she is joining the call?
Sure. We could also briefly show the video that we had prepared, because it will also give you a quick introduction to our partnership. Would that be possible?
Absolutely, we can do that. Bear with me a minute.
The fight against women's cancers has received a major boost that could help save over 5 million lives. Breast and cervical cancers are largely preventable or treatable in richer countries, but are often a death sentence in the rest of the world. Most of these deaths could be avoided if modern prevention measures, cancer screening and treatment were in place. The Islamic Development Bank has joined forces with the International Atomic Energy Agency to mobilize the funding and expertise needed to tackle this issue. Saving Women's Lives from Cancer, a global initiative for breast and cervical cancer control, will bring the international community together to deliver tangible results so that more women will have access to treatment. Between 70 and 90% of breast and cervical cancer patients require radiotherapy, but it is often hard to access. The projects funded by the new initiative will expand breast and cervical cancer control programs, including the upgrade of cancer facilities and the training of cancer care professionals. The bank has committed an initial $10 million US in grant funding, and the partners are now seeking other technical experts and donors to contribute to this important initiative.
Millions of women around the world, but in particular in developing countries, are dying because of cancers that are perfectly treatable and curable in many other places. We have the technologies, we have the science to do that, and we have the resources. It's time to put this together and put an end to this tragedy.
The partnership between the Islamic Development Bank and the International Atomic Energy Agency will widely address cancer prevention, screening, diagnostic and treatment of women in our common member countries. This partnership will contribute to saving the lives of up to 5 million women from breast and cervical cancer over the next decades.
Help us to save lives and join the global effort in fighting women's cancer.
Thank you so much. So you saw our video now introducing the initiative. Do we have Dr. Hayat back with us?
Hi, Anja. We do not have her back, but what I'm going to do is I'm going to share her slide, and she's going to be joining from the phone, so you'll be able to hear her talk as well. Just bear with me a minute.
I promised you this is a panel about innovation, so we'll try.
I can hear you.
Okay, perfect.
Can you hear me?
Yes,
Yes, we can.
yes,
hear you.
we can hear you, and we are innovating,
Okay, so
Dr.
slide
Hayat.
showing the statistic, yes?
Yes, that is.
Yes,
correct.
it's a statistic, breast cervical
Okay,
cancer.
so I will continue. I'm sorry about that. I don't know what's happening with the internet. It was fine all day, but anyway, we'll manage to overcome any hurdle because we are here to make things to make a difference. So as you see from the statistic, it's not fair because you know, if we can see the statistic, it's not right for women who are suffering from breast cancer, for example, living in US or Australia, had more chance to survive than the one in Jordan or Mali. And if you can look at the blue statistic as well, when women suffering from cervical cancer in low-income countries are 6 times more likely to die. And of course, this partnership with IAEA and hopefully with all of you, we need to fight these statistics. Next slide, please. So hopefully by this partnership, within the 5 years, as we put, you know, the initial program, we're going to help and aiming to save over nearly 5 million lives combined by breast and cervical cancer. But our partnership to survive, we must be, as we heard, to be creative about resource mobilization, also innovative when it comes to searching for solutions for the developing challenges. Next one, please. So what we are, our partnership, what we are going to achieve with this partnership?
Next.
Many things. I mean, we are really left nothing behind. We want to make sure that the whole value chain, the holistic solution we can provide. So the key area that anybody of you, of course, you can partner with us is upgrading the establishing cancer care infrastructure. We do have some, but of course they need improvement. And that's also part of what we're going to do together in this. So we're going to improve the cancer care facilities. The other thing we need to do as well, increase screening coverage for early detection, diagnose as the front line of prevention. Also, through this partnership, we're going to increase the capacity of the existing health facility in terms of the training. I want to increase the power of the caretaker because we do have a shortage, very much, especially in the low-income countries. And number 4, it's very important throughout this partnership. We want to make sure that the quality practice throughout the whole partnership to ensure that we are helping women in the best way we can. You know, we give them the best so we can have the best impact. Next slide, please. We heard from Dr. Mona and the title of our session, innovation, all aspects, you know, in terms of finance, mobilization, also about ideas. As you know, everybody knows about Sustainable Development Goals, but I wanted to remind you, in 2015, UN realized that science, technology, and innovation will always be at the heart of SDG. You know, to have renewable energy, to have food security, you need innovative ideas, you need technology, you need science, as you know. So this is an important to unite the visions of scientists and policymakers and seeking the best path to SDGs through carefully driving STI and the scientists that fuel it. So that's exactly what the UN, because the government here and policymakers, they want from scientists the best solutions, the best ideas, but also at the same time, how we can provide the right environment. So, and that's why STI is a key pillar for the Islamic Development Bank. That's why His Excellency Dr. Bandar Hajjaj, the President of Islamic Development Bank, put SDG as the heart of ISDB vision, because all our work in a multilateral developing way. So because we believe science is unlimited, innovation is unlimited, so we can reduce our civilization is unlimited. Next one, please. And it's very nice to hear from Dr. Mona, you know, science, technology, innovation can be transformative if harnessed in the right way. So early last year, we, along with the IAEA, we launched an urgent call for innovation to find and reward solutions for strengthening the national health systems in the area of breast and cervical cancer prevention. That's include we are challenging the scientific institution to find early detection, diagnosis, and treatment, and also expanding and scaling up the capacity of effective, safe, and sustainable cancer therapies. Why? Because as you heard, we need to be engaged with the frontier of science to be able to provide the best solution, an easy solution, an affordable solution for women around the world and for our member countries. And we launched our competition through our Engage platform. The ICB established with one-of-a-kind digital platform to engage with all stakeholders in the South country and the world, provide the ecosystem of innovation for scientists, entrepreneurs, community, policymakers, government, and also through our Transform Fund. And we received amazing, as you can see, from around the world, and we gave a prize to 4 top winners, and also that we go through the screening with our
Hi, Anja. Sorry about that. I think I lost her on the call as well. We seem to have bad network from her side. Just bear with me a minute. I'm getting a call from her.
Huh?
Hi, doctor. You can continue again.
Yeah, okay. And I know I can continue, no problem.
Yeah.
And we're so delighted to receive top recommendation. We gave each one of them $50,000 and to advance in their project. And we have a researcher from Bangladesh, Switzerland, and Uganda, and so on. Next slide, please. This is an important slide, of course. And this is how we partner. And as Anja mentioned, we need to have innovative ways. So developing partnership is a key strategic priority for the Islamic Development Bank, especially such this partnership. We begin to, and we need to really begin the conversation to encourage Muslim and non-Muslim world to talk about female health issue and to remove that social stigma around it. And through this initiative, we will using a blended finance type of fund. And I will explain to you a little bit more, but we use innovative way of blended finance funds established, and I will talk about the detail more in a minute. But we're using through this the instrument involving 5 Ps, which is coined by His Excellency Dr. Bandar Hajjar. What does that mean? We don't want to leave anybody behind. So this partnership, the 5 Ps refer to partnership between public sector, private sector, philanthropic organization, and people's civil society. So there is a variety of partnership opportunities for this program, and we are really looking forward to discussing it with you during this session and later. Next one, please. So the fund, if you can see here, is about operational business finance fund. Is estimate budget for it is $500 million for next 5 years. And we've been focused, we selected a proposal from least developing country. We've been engaged with them, with the government, with the related institutions to make sure that we understand and screen and landscape what really they need in terms of technical and financial help. And you can see the name of here of the 17 countries: Benin, Burkina Faso, Djibouti, Iraq, Ivory Coast, and so on. And so far, we raised 144.5 million, and that's combination from ISGB, a grant from IAEA, also from our member countries because they're really engaged, and also from non-member countries. You can see Belgium, France, Monaco, Russia, Sweden, UK, and USA, and we have also from private sector and also philanthropy. Thank you very much, Direct Aid, for giving us a grant as well. Next one, please. So the blended finance idea is very innovative because you can see here, anybody can be involved with us. And you can be involved in 3 option ways. You can have money direct to the fund. You can be a specific project and program you need to fund or be partner with this fund, or in kind contribution, including facilities, technical know-how, and so on. And the idea to have this type of fund because we want to make sure that we provide a good package, an attractive package for the private sector, because it's important. you see the number of cases is high. The demand is high. With COVID-19 situation is getting worse, so we need to have everybody engaged, and that's why we are here. And I'm happy to serve all the women around the world to this an amazing cause. So because we wanted to have all the stakeholders, we want to managing risk, we need to reduce transaction costs and also increase efficiency through a better coordination and alignment of partnership. And this is, I stop now for more questions, and I'm sorry for the technical thing, but I don't find it is a problem. If you can hear me, if you can engage with me, if you hear our passion and commitment with Anja and IAEA, we can make a difference. Thank you very much, Anja.
Thank you so much, Dr. Hayat. And indeed, this is just the beginning of a conversation. So we will have many more, and we are looking forward to getting further details and also sharing with all of the audience out there that is listening to us and that is interested in potentially also partnering and becoming part of this movement. Let me now move to our next panelist, Dr. Al-Sumait. Dr. Al-Sumait, can we show his slide as well, dear colleagues from the logistics? Here he is. Dr. Al-Sumait is the general manager of Direct Aid Society, an organization founded in 1981. Prior to assuming his role in Direct Aid, Dr. Al-Sumait was a member of the board of the directors of the Direct Aid Society. He also managed various agricultural and livestock investment projects and has participated in many medical and relief operations in camps across Africa. As a graduate from King Faisal University's College of Veterinary Medicine and Livestock, he was also the head of the Department of Epidemiological Surveillance and Common Disease at the Animal Health Department at the state of Kuwait, and a member of the Joint Diseases Committee. He has also served as editor-in-chief of the Al-Kalatha magazine. I hope I pronounced that correctly, Dr. Al-Sumait. Dr. Al-Sumait, your organization, Direct Aid, is a voluntary non-governmental organization that has been working for almost 40 years in Africa, in Yemen, and around the world to help communities in need. Would you please share with us your experience in working with grassroots organizations and also directly with communities in need, many of them very difficult to reach and also in remote areas? What do you see as opportunities also for the future as we all move on the cause of the elimination of cervical cancer? Dr. Al-Sumait, over to you.
Okay, thanks, Anja. I want to share my presentation. Yes, thank you. I want to talk briefly about Direct Aid Society. Started its activities in 1981 as a voluntary non-governmental organization concerned with developing places of greatest need in Africa. And now, as my primary mean to change the tragic situation of targeted people in 30 African countries and Yemen, that the method of work at Direct Aid Society depends on the direct implementation of all its activities and projects in various African countries through its field offices, that we have more than 8,000 employees on the ground in Africa that help our vision and mission in Africa. Direct Aid Society in Africa provide a set of various health programs. If we can talk about the focuses in its work on health, educational and development project that achieve sustainable, and the society aims to carry out development work for the less fortunate communities, targeting the neediest social group, the sick, orphans, disaster, and famine victims, and carrying out all righteous and benevolent activities. Direct aid achievements: more than 115 centers, 4 universities, 310 schools, 7,900 employees, 248 clinics, 6 hospitals, 214 women's training centers. The strategic partnership, one of the main pillars of humanitarian and charitable work, is built on the strategic partnership between humanitarian and aid organizations, as well as governmental international organizations. These alliances are essential in developing poor communities and require proper mechanism for coordination of joint initiatives. Partnership is the essential in direct aid work, and their goal it is to integrate with international and local alliance to amplify the volume of achievements to make a big difference on the ground. Our main partners, as international organization, we have 13 partnership, and with the governmental 81, and a framework convention with the government as 30, and local organizations 51, the total 175, that in 2020. Our POC with the ISDB and IAEA treat needy poor patients for improvement of human life in developing countries, provide training for the healthcare staff to provide curing service, improve clinical and diagnostic infrastructure of health clinics and hospitals to improve their ability to treat cancer patients by providing clinics with mammogram device and building an oncology unit, diagnose and prevent disease morbidity with early diagnosis and clinical examination for mothers and pregnant women in direct aid clinics, execute medical convoys with specialized doctors who are able to clinically diagnose breast and cervical cancer, vaccinate women and mothers against cervical cancer through the vaccination program implemented by direct aid, educate women about this disease and training them to self-diagnosis for breast tumor, and to educate girls in high school and universities, and to train a number of them as leaders to spread awareness among women, conduct awareness campaign with printed flyers and brochure about this disease in local language and distributing them to the targeted group. Use direct aid on radio station in spreading awareness by familiarizing them with the benefit of disease early detection and urging women and girls to start early treatment. Organize surgical camps to remove benign breast tumor by teams of the most skilled local doctors. Direct aid health program, that the project, what can we do with this partnership, and number of occurrence and number of beneficiaries. Number of female students sponsored by direct aid at 2020, more than 5,000 female students on our universities. And in our schools and vocational training centers, more than 5,250 females. Now we have more than 284 clinics can serve this program. In conclusion, direct aid opened its doors to its asset and logistic services in 30 countries to any organizations that would like to make use of it. Thank you, Anja, and thank you all.
Thank you so much, Dr. Al-Sumait. Thank you for everything you're doing. This is really impressive. And also for the opportunities to for others to partner with you and benefit benefit from the extensive network, but also expertise that you have. And I really appreciate also the very concrete examples that you have given, how we could actually bring our expertise, our resources together to really make a big difference, as you said, because it is in the end about making a big difference. Because it is time to be ambitious and think how we can take all of this to scale. Dear friends, I also have prepared a quick presentation on the IAEA, which I would like to show to you now. Just to also reiterate a little bit, that also the IAEA is one of the UN organizations which is really interested in bringing innovation and partnerships to the forefront, and is part and parcel of the global effort on eliminating cervical cancer. Just quickly, we are a long-standing organization with over 60 years of experience. We have a lot of technical cooperation programs all across the world, and at the moment we have around 115 active cancer-related technical cooperation projects in our member states. Overall, our member states are 173 countries at the moment. And as I told you, I'm the head of resource mobilization of the Program of Action for Cancer Therapy. This is a joint program with the World Health Organization, and we are trying to help member states to integrate our services into a broader, a strong national cancer control program. Here, why are we so focused on cervical cancer, and why this is such an issue that is close to our hearts? We already heard, of course, the statistics. We know that one woman dies every 100 seconds of cervical cancer in the world, most of them in developing countries. And that is, of course, a statistic that is very sad, and we would like to change. At the same time, as we know now, with a comprehensive approach towards cervical cancer, radiotherapy, which is the core business of the IAEA and where we provide support, is really necessary to provide life-saving services, either alone or in combination with other treatments. For cervical cancer, 71% of all cervical cancer patients that have invasive disease require radiotherapy to actually have access to a cure. And that is where we immediately can save lives if we can provide that service to all in need. Just to show you some statistics here, recently an investment case was built around the need of continuing to invest in access to life-saving services like radiotherapy in the world, also as we roll out vaccination. We know that even if we achieve 100% coverage, or 90% as we are targeting now with vaccines, HPV vaccination of young girls, over the years to come, we still need access to treatment for those women that will develop cervical cancer. And until actually for the next 20 years, 9.4 million women will need for cervical cancer treatment access to radiotherapy. So this will continue even though while we are scaling up access to vaccination program, early detection, etc., there's still a need for treating invasive disease. And it is good investment, because with investment there, we can save up to 11.4 million lives. And we generate dramatic socioeconomic returns. So for every dollar that is invested in radiotherapy for cervical cancer, you will get $14 in return in socioeconomic benefits. So this is productive lives, this is contributions of women to their families, to national economies, to their communities, etc. So it is really good investment. So why is the IAEA so well placed to also work together with others? The IAEA is a United Nations organization, and of course we are facilitating multi-stakeholder initiatives together with others, and we can approach this multi-stakeholder approach and also a multi-layer approach for addressing the cancer burden. We are combining the efforts of a range of partners, including UN agencies, private sector companies, development banks. The Islamic Development Bank is one of our prime partners. The philanthropic foundations like the Direct Aid Foundation you just heard about, and also non-governmental organizations to give women a fair chance against the disease. Overall, of course, we want to contribute to the global effort to save millions of lives of women from cancer. Here, we also have a very strong focus on working with the private sector and philanthropic foundations. There are many different opportunities to partner with us. Dr. Hayat has already talked about some of them. In addition, we're also always looking for combined program implementation for greater impact, joint advocacy and outreach, knowledge exchange, and of course, resource mobilization in all kinds of forms, because as we said, we need to be innovative around this as well. Just some examples on how we also work on specific partnerships with cervical cancer. In the UN, we have WHO and IARC, as we already mentioned, and you have heard about them already during the last 2 days. We are working very closely with UNAIDS, particularly on cervical cancer and HIV, and also UNIT-8. We are also part of the IAEA partnership. We are also part of the joint UN program on cervical cancer prevention and control with 7 other UN agencies, including UNFPA and the others that you have already met. And of course, we have our flagship program that was just presented on the partnership with the ISDB and others. I also want to briefly just mention that the IAEA as an organization is heavily involved also in research and development, and we have many different areas where we can collaborate with all of you also across the region and beyond in different areas. We will probably share these slides later so you can get more information as you want. And just a selected kind of compilation of different partners that we are working with. So the more we can add, the better, and really also an invitation to all of you to become part and parcel of our efforts. Thank you so much for this from the IAEA side. I think we have another 3 minutes for our panel. And we have a few questions. Thank you so much. In particular, quick question to Dr. Hayat. You mentioned access to financing, and also your last slide that you showed was about a new trust fund that is being launched. Can you say a few more words about this, and also in particular how other partners, organizations could participate if they're interested in this?
Thank you, Anja. Thank you, Brother Abdullah, for great presentation, and thank you for your help as well, as you also one of our great partners. Yes, so the fund actually is an innovative way of blended finance. We want to make sure that, because as I mentioned, the cause is huge, and the area we're going to cover also is so demanding. And with COVID-19, it's a lot of centers have been affected. So the way we put it together, so we have a blended finance type of model. We can have philanthropy, we can have private sector, we can have NGO organization, we can have in-kind and like direct aid, they can help us, and also, but they put direct money. But I'm saying that we can have all the value chain to help with this type of fund, because the 4 key pillar of the fund, as I mentioned, we need to make awareness and diagnosis. We need to upgrade the health facilities center. We need to increase the training, because we don't have enough training. And we need to also make sure that, the quality and standard are quite high. So in all of that, we need fund direct. We need to have a private sector to invest as well. We need to have philanthropy, people who have already experience on the ground to be partnered with us, because there's so many things that we can cover. So that's the whole idea of blended finance. Anybody can choose the mood of partnership, and we are happy to discuss any further collaboration or any question referring to be partnered with us. And as you know, we're going to have a pledge soon together, and we need to make sure that we get the state of the fund. We have an advisory board, and we need to make sure that really the whole structure of the fund is ready for the pledge, and we are already establishing the fund. So they can contact us, and it's the whole idea of that innovative way, as everybody knows about the blended finance, innovative way of making sure that guarantee and make all the stakeholders comfortable as we are managing risk, and make sure that the whole coordination come to the best impact for that.
Thank you so much, Dr. Hayat. And I'm also extending this invitation to everyone to really get more information, and please engage with us. We would be very happy to provide further information. And as Dr. Hayat said, we are preparing a pledging conference and hope that we will have as many partners as possible joining us in this. Dr. Al-Sumait, I know we are running out of time, but still, you have mentioned that you're using quite extensively also expertise from Kuwait, from other specialists that are working in the region also to benefit communities in Africa and that usually don't have that access to expertise. Do you have some call also to other colleagues out there that are listening to us today on get some ideas on how they could get involved, also to share their expertise, know-how to the benefit of those that are in need?
Yes, Anja, I think it's depend on the medical expert volunteers and their schedule. We usually reach out for new volunteers or contact the previous one. And our heart and our organization is open for any volunteer they want to join us and join our medical camps or campaign. We are very happy to their visit to our office in Africa and join with us with our campaign.
Thank you so much. And indeed, we will work with the organizers to make sure that all the details are available so that volunteers and everyone who wants to be part also can get in touch. So we're coming to the end of our session. This has been really an exciting discussion. And I think we could actually discuss even more. But just to briefly sum up, as I think we have shown to you quite a spread of different ways of how we can innovate together to really make a big difference in the fight against cervical cancer in different areas, and how we can use this opportunity of a lifetime that we have right now working with so many partners. Thank you so much, everyone, and over to you, Rode. Thank you.
Thank you very much, Anja, for providing such a good overview already. That makes my work very easy. And thank you also much for all the panelists that took part in the panel for your adaptiveness and flexibility. I think this also highlights the innovative character that you need to have in order to work on the technology and the partnerships and the innovations on what you have presented. So thank you so much for taking the time and for sharing your experiences with us. And then this brings me to the very last part of our agenda today. We will start with the closing remarks and the forum announcements. And for that, I'm very happy to welcome back Dr. Sawsan Al-Mahdi and Dr. Shibal Sabani.
Thank you very much, Rhoda, and thank you very much for everybody for this amazing day. I think that's it. This is the end of the forum. I mean, it is a very happy but also sad moment that we have to say goodbye to everybody. It was an amazing 2 days. Yesterday was amazing. Today is even more amazing with the voice of patients and the reflection that we had and the partnership and the power of technology as well. I think just ending with this panel from IAEA is a very powerful way to end the day. What do you think, Dr. Shibal? How do you feel about the forum for the past 2 days?
Thank you, Dr. Sawsan, and thank you also for all our guests and speakers and participants, but also the moderators who did an amazing job, and also they were able to extract the ideas from our speakers and also from the audience. Thank you very much. Yes, I agree with you 100%. I want just like to remind the delegates that they can access day 1 and day 2 the presentations and the videos from the platform, and it will be available for the coming month. It will be also uploaded on YouTube. Over to you, Dr. Sawsan.
Thank you very much, Dr. Shibel, and thank you for reminding us about this very important information. And I would like to really thank all the delegates who are attending. I heard today we have almost reached 400 of the attendees. So thank you very much for all of you who attended and bared with us. And thank you for your interactions and good questions as well, because it really made the panels and the very interactive. I would just remind myself and remind all of us that we started the day with a very powerful keynote about faith, religion, and culture as a driver in cervical cancer elimination. It was delivered by Professor Gamal Surur. He is a professor of OB/GYN, director of International Islamic Center for Population Studies and Research at Al-Azhar University. I believe that was one of the sessions that received lots of good feedback from the delegates. Your thoughts, Dr. Shibel?
Yes, definitely. Definitely, I agree with you. It was really interesting. We had a lot of comments from the chat box, and I think most of them, they were already addressed. Since you started with the recap of the day 2, I would just like to take over very quickly, if you allow me, Dr. Selson. I know I'm aware about the time constraints, but I will just to summarize what has been discussed. Of course, after that interesting session, we started with theme number 3, which was about the social advocacy in cervical cancer. And the panel 1 was about voices of patients, focused organization success story. It was very well moderated by our colleague and friend, Hayat. And we had very distinguished panelists. So the first panelist was Dr. Heather, the executive director of Together for Health. So she talked about how we can engage media to speak on cervical cancer and the intergenerational dialogue, so girls and women can talk more about prevention together. She also talked or advised us on how we can break these taboos because cervical cancer is stigmatized in many communities. But we need to speak up to change and make communities feel more comfortable to speak about it. We had also Ms. Sana Seri, member of the board of directors of Bahia in Egypt, in Cairo. And I would like to say that now I'm in Cairo, I'm speaking from Cairo. And so she talked about the organization Bahia, which continues to provide services for women fighting cancer in Egypt through awareness sessions, medical services for screening, treatment, and psychosocial support, as well as training for medical students, even during the COVID-19 pandemic. Our next panelist was Cecilia from Philippines. She's the chair of the Cervical Cancer Prevention Network. And she pointed out the importance of forming support groups for cancer patients and their families to create bonds and encourage them to raise their voice and speak out in their communities. And then the last but not least, the fourth panelist was Mr. Nashwa Abdulaziz from Kuwait's Cancer Control Center. So he highlighted the efforts of Gulf countries, including Kuwait, to work on cancer screening, prevention, and treatment for citizens and expatriates, who make up a large number of population in most of the GCC countries, as we all know. After that, we had the second panel. It was about how can media support proper communication to create impactful messaging. It was very, very well moderated by our colleague and friend, Samir Darabi, who is the regional communication advisor in UNFPA. So we had our very well distinguished speaker, Dr. Ibrahim Al-Kardani, with whom we work on different cancers, breast cancer, cervical cancer. And he's a freelance, but actually he was the former WHO regional spokesperson. He very well highlighted the importance of adequate communication to keep people informed during public health emergencies and to give the right information and to avoid what's known now as an infodemics. The second panelist Tamika talked, she's a survivor and advocate from USA. She talked about people who although survived major impact on personal life. As her, she no longer can have children, celebrating of 20-year cancer-free. She said that survivor stories can be used and can be used as a tool to share information about the disease and to advocate for adequate care. And I comment very well what she has done, because this needs a lot of strength to do that. Thank you very much, Tamika. Our next one was Kate Sanger, Head of Policy and Communication from Joe Cervical Cancer Trust from UK. So she highlighted the fact that media can hurt too through hurtful headlines. However, survivors are experts in their story, not necessarily medical experts, but they know the story from the survivor point of view. And this is very, very important. Thank you so much, Kate, for your insights. Then we had the team 4. It was about advances and innovation role in the ecosystem of cervical cancer elimination. The keynote was given by Dr. Mona Saraiya, medical officer and team leader, Division of Cancer Prevention and Control in the CDC USA. So Dr. Mona shared about the recent development in the USA, their efforts on prevention and screening. She shared a wide range of IEC material that were developed to inform parents, health workers, and so on. Thank you so much, Dr. Mona. And then for the panel number 3, which was about the role of technology, innovation, and partnership in achieving equitable access to cervical cancer services. So I think this was a very good session as well, that was moderated by our colleague from our sister agency, IAEA, Ms. Anja. She is the head of the Resource Mobilization and Strategic Partnership at the Program of Action for Cancer Therapy in IAEA in Vienna, Austria. We started with the first panelist, Dr. Sindi. Actually, she did very well. She is the chief of the president of the Islamic, chief advisor, sorry, to the president of the ISDB, Islamic Development Bank. She highlighted 4 pillars for partnership with countries in need of financing to tackle cervical cancer, of course. Improving cancer care infrastructure, prevention and diagnosis, cancer treatment, quality assurance, and quality management. We will be in touch, Dr. Hayat, don't worry about that. The second panelist was Dr. Sumait, DG Direct Aid from Kuwait. Dr. Sumait pointed out or shared with us the direct implementation of all its activities, direct aid activities and projects in various African countries through the field offices. Actually, 284 clinics were implemented to support women over 30 countries. Congratulations, Direct Aid, and congratulations, Dr. Sumait. And then the moderator was also a panelist, our friend Anja. She mentioned the role that IAEA is playing to help member states to integrate their services to help improve the cervical cancer. She also pointed out or highlighted that 71% of cervical cancer patients unfortunately require radiotherapy. And here I want to highlight again the importance of early screening, prevention, primary prevention and early screening. She also mentioned that 9.4 million women for cervical cancer treatment will require access to radiotherapy, and hopefully we will be able to provide this treatment, but also most importantly is to prevent the cervical cancer to don't require to go to radiotherapy or even surgery. Over to you, Dr. Sausan, and thank you very much for all our speakers and panelists.
Thank you, Dr. Shibel, for this great overview. I totally agree with you. It was an amazing day. The panelists, the keynote speakers, the panels, the moderators did an amazing job. And really, we had distinguished speakers who really highlighted the key points that we want to speak about. Now, after we have concluded the 2 days, it's always beneficial to reflect back on why we did the second Cervical Cancer Forum. And when we started the organization and the planning for the Cervical Cancer Forum, we went into the planning with two distinguished objectives. The first objective was to bring together global stakeholders, including academia, community leaders, scientists, policymakers, to promote and enhance pragmatic collaboration to more effectively address regional and national response to HPV and cervical cancer in the Arab region since the previous forum. So my question to you, Dr. Shibel, do you think, and to the even to the delegates, do you think that did we succeed to do that? Did we succeed with our first objective into bringing all the stakeholders and the key players in the area or under the umbrella of cervical cancer into our forum today and encourage this free dialogue? So over to you, Dr. Shibel.
Was it planned that I have to answer this question? Okay. So thank you very much, Dr. Sausan. Actually, yes, that was one of the objectives, and I think we had very distinguished speakers. We had participants, moderators and keynote speakers as well from all over the world, but also with different institutional backgrounds. We had the academia, policymakers, activists, service providers. We had the UN system, we had NGOs, international NGOs. So I think it was really important. But this is the kind of participatory approach that we need, not only in terms of forums, but also before developing any national strategies, regional strategies, this kind of bringing everyone together from different perspectives. And here I want to highlight again the role of the survivors themselves to share their experiences, but also to be involved in the program design and the program implementation. So I think we succeeded to achieve this objective. But since you took me by surprise, I will ask you the same question regarding the second objective. Our objective was to discuss the establishment of sustainable and equitable access to cervical cancer and also HPV, cervical cancer services and HPV vaccination, including under the COVID-19 pandemic. What thoughts about that?
So before I apply to your question and to the second objective, Dr. Shibel, thank you for feedback on the first one. So I think for that, I can put a big tick that we have succeeded on that front, and we have actually established our first objective in bringing everybody together, and everybody knows each other right now, and we have, prepared, made this platform or this forum as a platform for people to continue discussing and continue collaboration. And going back to your question about the second objective, I think, and I'm not saying that because I represent United Arab Emirates, but I'm saying that is that from the experience of UAE, I think we can take that experience and we try to scale it up to other countries as well, and see what are the common similarities, but also what is most important, what is the differences that can be boundaries or obstacles to develop such widespread eradication for HPV or cervical cancer. So I think we can have a sustainable and equitable even under a COVID-19. I mean, I think Dr. Lamia said it very well yesterday in her during the panel. Dr. Lamia represents Abu Dhabi Department of Health, where she said that they utilized primary health care, which is an innovative way of looking at how to provide access. They utilized it for school girls to go and take their vaccine. So even if the schools were not operational, even people were doing schooling from home, home, yet there was still a way to communicate the message that you can still take your dose, you can still take your first dose, the second dose, or third dose of HPV vaccine through these open services. And we all know that healthcare in pandemics never shut down. I mean, healthcare, if anything, is the only sector that continues and thrives in healthcare issues and emergency and in pandemics and situations like this. So I believe benchmarking on successful experiences, and I think the forum brought a lot on the table of successful experiences, not just from UAE, but from other countries, benchmarking on that. And also these amazing roadmaps that, is being established now, WHO elimination strategy, other agencies as well, including UNFPA, you have also a lot of roadmaps as well. So I think working collaboratively is very important, and definitely sustainable and equitable cervical cancer and HPV eradication program can be achieved. Over to you, Dr. Shibil.
Sorry, I was muted. Yes, I cannot agree with you more, Dr. Sausan, and I think we need to build on the experience of UAE. And here I want to highlight the role that South-South collaboration can play in terms of sharing knowledge, sharing evidence, documenting good practices and share them with different countries. This is something that we need to improve, and I hope that we can all commit to that. Maybe we can go directly to discuss a little bit the declaration of this forum, but maybe before that you want to make some announcements.
Yes, thank you, Dr. Shibil. Thank you very much. Since, Sharjah Declaration, the first forum was quite inspirational. I would call it maybe a pilot forum for us, because it was the first in the region. We didn't know what will be the feedback from it, but I believe it was a great springboard for everything that's happened after it, even the WHO elimination. I'm not taking credit, but I'm saying it was a great springboard of bringing people together and starting that discussion and dialogue. And what happened with this first forum, which was back in January 2019, was the actual Sharjah Declaration 2019 3x3, which was actually a very inspirational declaration, because if you have noticed during the whole forum of the 2 days of the second forum, we were always reflecting on part of the Sharjah Declaration, on the whole Sharjah Declaration, which I believe led us to and inspired us to actually think about a second edition with your kind self and with the partnership of UNFPA. Is that our conclusion of today's forum is the declaring of the Sharjah Declaration Edition 2 under the title Our Commitment, Our Pledge. And if you allow me, Dr. Shibil, I will be the first to take the pledge for the Sharjah Declaration Edition 2. And you will find the Sharjah Declaration at the end of the forum. It will be in the resources, and I will read it now. Sharjah Declaration on Cervical Cancer, second edition, Our Commitment, Our Pledge, Accelerating Action on HPV and Cervical Cancer. We, representative of government, academia, international organizations, civil society, and advocate, participation in accelerating action on HPV and cervical cancer, a regional forum to celebrate progress and boost the national and regional response to take action against cervical cancer elimination. Meeting in Sharjah virtually of 27 and 28 of January 2021, under the patronage of Her Highness Sheikh Jawahir bin Mohammed Al Qasmi, wife of the ruler of Sharjah, founder and royal patron of Friends of Cancer Patient, international ambassador of the World Cancer Declaration of the Union for International Cancer Control, and the international ambassador for childhood cancer for Union International Cancer Control, affirming our commitment and my commitment to improve access to screening, vaccine, and treatment for HPV and cervical cancer in the Arab region, and in the line with the WHO call for action toward the elimination of cervical cancer, hereby take this declaration. I was the first, so I'm opening the floor to anybody who wants to take it second, maybe you, Dr. Shibil. And if one of the delegates want to take it, they can just write in the chat box that they take the pledge. Over to you, Dr. Shibil.
Thank you very much, Dr. Sausan. Actually, you did it on behalf of all of us, but I encourage all colleagues to affirm their commitments through the chat box or through our emails and so on. But I will read it again for all of us, and I will make my commitment as well. So we, representatives of governments, academia, international organizations, civil society, and advocates, participating in accelerating action on HPV and cervical cancer regional forum to celebrate progress and boost the national and regional response to take action against cervical cancer elimination, meeting on the 27th and 28th January 21 under the patronage of Her Highness Sheikha Jawahir bint Muhammad Al-Qasimi, wife of the ruler of Sharjah, founder and royal patron of FOCP, international ambassador of the World Cancer Declaration for the Union for International Cancer Control, international ambassador of childhood cancer for UICC, affirming our commitment to improving access to screenings, vaccines, and treatments for HPV and cervical cancer in the Arab region, and in line with the WHO call for action toward the elimination of cervical cancer. Hereby make the following declaration. Over to you, Dr. Sausan, and very, very happy to make this commitment on behalf of UNFPA ASRO.
Thank you, Dr. Shibel. And again, a warm thank to everybody. Thank you, the UNFPA, for your great partnership. And thank you all the speakers and the delegate. And inshallah, hopefully we can see each other again in the next 2 years and maybe in the third forum, inshallah. Thank you.
Thank you so much. Thanks, everyone. Goodbye. Hope to see you soon.